Assalamu alaikum everyone. Central Asian Medical University presents for you quite acceptable lectures. Our department is Basics of Pathology. I am patafiziologist, assistant of Department of Basics of Pathology. My name is Mukarram Fumijan, and our today's topic is devoted to gluconeogenesis, diabetes mellitus, and diabetes insipidus. Welcome to our lecture. First of all, we should review our biochemical knowledge. First of all, look at that. And that's a schematic view of the gluconeogenesis and glucose metabolism. Look at that. That's glucose. Glucose, when the glucose enters the cell, it is phosphorylated by glucokinase, and this ferment's name in the liver is hexokinase. And after that process, the glucose 6-phosphate converts to glucose 6-phosphate, fructose 6-phosphate, and by phosphofructokinase 1, the fructose 6-phosphate converts to fructose 1,6-biphosphate, and the next step, the fructose 1,6-bisphosphate divided into two biochemical substances. First one is glyceraldehyde 3-phosphate. The second one is dihydroacetophosphate. The dihydroacetophosphate, when it combined by NADH, and it can form NAD and glycerol 6-phosphate. And the next step is converting the glyceraldehyde 3-phosphate to the phosphoenol pyruvate. And the phosphoenol pyruvate by pyruvate kinase converts to the pyruvate, and pyruvate enters to the mitochondria, and the pyruvate bind to the carbon dioxide and form oxaloacetate. Oxaloacetate exit from the mitochondria, and by phosphoenol pyruvate carboxykinase, it discharges carbon dioxide and becomes phosphoenol pyruvate again. And it may seem to you it's quite difficult process, but I should try to pay your attention to the three main parts of this diagram. If you let me, I can clear it down, and I start gluconeogenesis. This process is metabolism of the glucose. Okay, and gluconeogenesis means that forming the glucose from the substances that are not carbohydrates. First of all, please pay your attention to the glycerol 3-phosphate. You know, biochemistry wall, and glycerol 3-phosphate is discharged from the triglycerides. You know, triglycerides consist of one glycerol and 3 fatty acids. Yeah, and glycerol use NAD and form NADH and form dihydroacetophosphate. Dihydroacetophosphate combined with glyceraldehyde 6-phosphate. As a result, the net result is glucose is formed from the glycerol 6-phosphate. It means that when you are so hungry, your fat become glucose by this process. It's quite good, okay? And I should mention that in the alcoholism, when the patient consumes some amount of alcohol, the alcohol use all of the NAD, and it means that glycerol 6-phosphate couldn't convert to the glucose. It means that the glucose level will be decreased, and when the patient consumes alcohol, the hypoglycemia may occur in the blood of the patient. Okay, and our next process is lactate. The lactate is discharged from erythrocytes. Because of lack of mitochondria, erythrocytes couldn't form the lactate to the citric acid cycle. As a result, it has to discharge lactate to the serum. And when the serum arrives to the liver converts the lactate to the pyruvate. Pyruvate, by this process, can form glucose. Okay, that's the gluconeogenesis, and that's the alanine. Alanine is come from the muscle. When the liver say to the muscle, I need alanine for forming the glucose, the muscle says that I can give you any amount of alanine that you want, and alanine converts to the pyruvate, and as a result the pyruvate, the net result is formed to the glucose. That is a part of the muscle that play an important role in maintaining glucose level in the bloodstream. Because the muscle is half of our body, and when we are so hungry, the muscle give its alanine for maintaining normal amounts of glucose in the blood. And you can say that we use glycerol 3-phosphate for gluconeogenesis, and where we spend the 3 fatty acids. Without any doubt, I can say that we can use the acetyl-CoA from the beta oxidation of the fatty acids for getting the energy for the gluconeogenesis. It means that when we break down our fat, we use glycerol 3-phosphate for gluconeogenesis and fatty acids for getting the energy for this process. Don't forget that. That's the main part of the gluconeogenesis. Our next information about the diabetes mellitus. Diabetes mellitus is consists of two types. First one is insulin dependent, and second one is insulin independent. Okay, and look at that. That's a pathogenesis of the diabetes mellitus. That's the second type of the diabetes mellitus. The abnormal insulin sensitivity means that the GLUT receptors couldn't act normally to the insulin. As a result, the amount of insulin will be increased because of overstimulation of the beta cells in the pancreas. And as a result, in the second type of the diabetes mellitus, the patient suffers from the obesity. Okay, because of obesity, the patient can have some kind of difficulties, maybe some kind of movement or breathing difficulties. And look at that, and the high glucose level and high free fatty acids and genetic factors as a result mean that, and the central obesity insulin resistance syndrome can cause progressive loss of beta cells. It means that the patient couldn't form normal amounts of insulin to the bloodstream. The net result is diabetes mellitus can be formed. That's the second type of diabetes mellitus pathogenesis. I should mention that the first type of diabetes mellitus, that's insulin dependent diabetes mellitus. The pathogenesis is genetic or genetic loss of function of beta cells. It may start in the patient from the early childhood or during the teenager life. And I should say that the second type of the diabetes mellitus only occur when the patient get older. I can say some kind of main reasons for the second type of diabetes mellitus is chronic stresses or this kind of emotional positions that can disturb the normal function of the organism. When the patient suffers from chronic stress, and it means that the high level of catecholamines and cortisol and glucagon maintained during this kind of chronic stress, and it means that all of these hormones that I above mentioned cause the hyperglycemia. Hyperglycemia cause some kind of changes in the GLUT receptors, and as a result the receptors couldn't act normally to the insulin. That's the main pathogenesis of the type 2 diabetes mellitus. And the type 1 diabetes mellitus, it's clear that there is no insulin and there is not enough amount of insulin in the bloodstream, and the patient may suffer from the hyperglycemia. The treatment is the same. The endocrinologists use some kind of substance, for example metformin, diaformin, and sulfanylamines for decreasing the amount of glucose, and they inject the necessary amount of insulin subcutaneously for the patient. By this taking this kind of drugs regularly, the patient can maintain its health condition without any difficulty. Okay, our next information is diabetes insipidus. Diabetes insipidus have two types. First one is neurogenic and the second one is nephrogenic. In our today's lesson we will talk about both of them. First of all, I should provide necessary information about the normal physiology of the vasopressin hormone. Okay, the vasopressin hormone and oxytocin is synthesized in the hypothalamus, and by axonal transport they go there and stored in the posterior part of the pituitary gland. Okay, and when the organism need maintaining some amount of volume of the water, the vasopressin amount in the bloodstream will increase. You know, the hypothalamus is the center of the thirsty emotion. When the patient feels some kind of necessity for the water, the hypothalamus will excited and the amount of vasopressin will be elevated in the bloodstream, and it go to the kidney and reabsorb the water to the bloodstream. And it means that the amount of urine, total urine of the daily urine amount will be decreased, and the amount of water that maintained in retained in the body will increase. By this way, we save our normal amount of water in our bloodstream. In the central, that is the neurogen diabetes insipidus, the normal amount of vasopressin couldn't discharge from the posterior part of the hypophysis. As a result, the amount of the urine that's discharged from our body will elevated. Approximately 10 liters and 15 liters of the urine will discharge it from our urinary system. The patient's main symptom is the feeling so thirsty, and that's the main symptom of the patient. When we think about the diabetes mellitus, we should measure the amount of sugar in our bloodstream, and we can find it that the sugar amount is normal. And first of all, we should think about the diabetes insipidus. The next, the second type of the diabetes insipidus is nephrogenic type. In the nephrogenic type, the aquaporin receptors in the kidney will be disrupted due to so many kind of risk factors, and as a result, the normal amount of vasopressin in the bloodstream, but the acroporin receptors couldn't recognize this hormone. As a result, the total daily amount of urine will be elevated. Okay, and for the treatment of the neurogenic uh, uh, diabetes insipidus, we use desmopressin. Desmopressin is vasopressin when the brain couldn't discharge normal amounts of vasopressin from the hypothalamus. This tablet or spray is taken by the patient, and the amount of urine that discharged from the body will decrease it, and the patient say that I'm feeling myself quite good. Okay, that's a net result. That's the end of our information that I was going to give you. Thanks for your attention, and please try to subscribe our channel and try to share this information to your friends and other medical students if you think, of course, it is positive and beneficial for you. Thanks for watching.